Testing, testing. We good? twists and turns, but we've began preparing for this thing since February, and we continue to monitor the spread across the city. Dr. Walker will have more specific details shortly as we continue to see a number of our family and friends infected by the virus. While we've lost more than 100 of our residents, our mortality rate in Gary, or the rate at which our residents are dying, has dropped significantly. That's important to remember because I believe that it shows that we're aware, and you are also, of how it impacts us. Also, we continue to issue restrictions on businesses and houses of worship and other people who do business in the city of Gary, as well as our offices in our city. We want you to please continue to avoid large gatherings or large groups, even with your family members, and of course, continue to cover your face with a face mask as we have a mandate here in the city. This goes for public spaces and all public spaces indoors as well. Dr. Walker has issued a mandate for nightclubs as well as some other businesses, which he'll talk about shortly. Last week, our Gary Police Department temporarily shut down 8 different businesses. One of them actually had to be shut down twice, on Friday and Saturday, because they were not in compliance with our orders. They were allowed to reopen, but they're facing heavy fines, and if they continue to not comply, they will continue to face fines. Our police department will absolutely continue to shut down all businesses, in fact, that do not comply with the orders or the health department orders issued by Dr. Walker. And this could lead up to a revocation of your license as well. Police Chief Evans will go into that shortly as well. There's also some good news when it comes to COVID-19, and that is that the vaccine is arriving. The federal government has approved vaccination choices, and the vaccine will arrive here in Gary shortly. First, we expect the vaccines to go to medical facilities and care facilities, including nursing homes. But in the second phase, which should begin next month, we believe that residents will begin to be vaccinated as well. I will also take the vaccine, as well as I believe Dr. Walker has suggested that he will, in an effort to help show and set the example that it's an important step in helping us protect ourselves and our residents and our loved ones from the rest of the virus. But at this particular time, I'd like to bring up Dr. Walker. Thank you.
Good morning. I think today is probably the most significant day that we've had in this fight against COVID since the start of this pandemic. So I want to make sure that I'm really organized today to make sure that I get my message across clearly. First, I'm going to start with the numbers for the city of Gary and the state of Indiana. And then I want to talk about the next 7 weeks and what we can expect to see. And then I'll end up talking about the vaccination. I want to thank the mayor for letting me speak to the citizens of Gary today. I also want to thank Chief Evans, who's joining us today, for his enforcement of some of the rules that we've set forth. He's worked really hard with his staff, and we appreciate him very much. The numbers that I'm going to share with you now, you can find on our city website. There's a hub that has been developed specifically to give you the information that I'm sharing with you now. So go to our city website and you can find this information. And we thank Mr. Martin Brown, who's developed that hub for us. Okay, in the state of Indiana, our newest number, the total of positive cases in the state of Indiana is 430,401. As far as new cases, there's 5,050. So the positivity rate for the state of Indiana is actually 12.7, but for the last 7 days, it's been as high as 24.8%. We've had 35 new deaths in the state of Indiana for a total of 6,530 deaths in the state of Indiana. Okay, in Lake County, because often we talk about our positivity rates, The positivity rate for Lake County is 15.2%, but over the last 7 days, it's been 24.7%. In Gary, Indiana, we've had a total of 3,872 cases. In the month of December, which was the second most amount of cases we've had since the beginning of this pandemic, we had 539 cases, and we had 36 cases over the past 24 hours. And that's really significant because we expected to see a larger number after Thanksgiving, and so we instituted several rules. We continued our mask mandate, and then we implemented the rules that the mayor just mentioned at our nightclubs and bars, where we are closing our nightclubs and bars at midnight, and they're at 50% capacity. With those rules implemented, as well as you drove around during the Thanksgiving time, you could see that large gatherings were much smaller now. Families didn't have a large amount of cars in front of their households. And so that was very significant, and while we don't want to celebrate this victory yet, it looks like we may have avoided some of those large increases that we expected to see, which will tell you that if we implement simple rules, that we can fight this virus with simple tools. Now, we've had, in the last 24 hours, 1 new death reported. So unfortunately, we've had 110 deaths. I've lost several friends to COVID, and so it affects me greatly. It affects all of you greatly, and we don't want to see any more deaths in the city of Gary. So our 7-day average is now 38 cases a day, and we now have had 66 days in a row, over 2 months, of double-digit cases. So what can we expect over the next 6 to 7 weeks? Well, I don't want to paint a rosy picture because it's not. We're going to see increases. It's wintertime, so people are congregating indoors. During the Christmas time, we're going to have gatherings, and we're going to see those numbers increase. And through December, through January, through February, we're going to see those numbers remain where they are, fairly high now, where we see these averages in the 40s and 50s and perhaps higher. We prepared for this, though. We've continued to have our mask mandate. We've implemented rules to try to prevent the spread. We have a field hospital that is on ready in case it's necessary. And we still ask that everybody adhere to the rules and have smaller gatherings. We recommend Zoom meetings and Zoom gatherings, Zoom gatherings for Christmas. And we believe that this would help to prevent the spread. Now I'll talk a little bit about the new vaccination. So as you've heard, Pfizer has been granted emergency use authorization, EUA, for the vaccination, which is going to be given in 2 doses. As you've heard, this vaccination has to be shipped and stored at minus 70 degrees, which makes it extremely difficult. And in phase 1, and we're in phase 1 starting today, where you're going to see around the country people have started getting vaccinated today. Phase 1 here is going to be distributed by our hospital systems. And who will get vaccinated first? Well, obviously the frontline workers in the ICUs, in the COVID wards, so our providers, doctors, nurses, the janitorial service that would service those areas. And then also in our nursing homes, so residents of nursing homes, workers in nursing homes will receive the vaccination first. Phase 2, which should get started in about 4 weeks, we anticipate will then be distributed by our local health departments. And we will be targeting our essential workers. We'll be targeting our safety workers. And so you can anticipate by April and May, the general public will start to be vaccinated. And we want to encourage people to want to take the vaccination. We have now looked at large gymnasiums. We've been in talk with Holy Angels, who has volunteered to allow us to use their gymnasium on 6th and Polk as a vaccination center. So we're looking into the logistics of that. Now, I have family and friends that I've had several discussions with about confidence in the vaccination. One of the things that people say is, well, how do we get a vaccination this quickly? You know, in 10 months, how did this occur? It usually takes 10 to 20 years to develop a vaccination. I think we're actually asking the wrong question. The question really should be, why have other vaccinations taken that long? And the response would be because Generally in public health, money is not put into these type of things as robustly as has been into COVID vaccination. So vaccinations, other vaccinations should occur more quickly. Vaccinations for cancer, vaccinations for HIV. So we'll be pushing that message so that those vaccinations can be developed more quickly. Also, what you're hearing is that this is a new vaccination. This is an mRNA vaccination. But what they haven't told you is this is not a development over 10 months. This has been an almost 20-year development of this vaccine, of this type of vaccination of messenger RNA. It really took off when SARS, I mean, if you remember back in the early 2000s, SARS was a big deal. And so they started developing this type of vaccination at that time. And messenger RNA just basically sends a message to the cells to produce DNA that then produces protein that will produce these antibodies to be able to attack virus. In this case, there's a little spike. It's called a spike protein that's on the virus, and that is what the antibody will be able to attach to. Now, also, the African American community has been very reluctant to want to take this vaccination, and it's very reasonable that our community has had this nervousness. One, even before COVID, early in 2020, the anti-vaxxer community had targeted the African American community, holding rallies in civil rights churches to attempt to sway the African American community against vaccinations. So I'm staunchly against that. I think we're a vulnerable community, and we definitely don't want that to occur. Also, I want to mention a couple of things that have occurred through history. So in Boston, for instance, a slave owner inoculated 242 of the slaves with smallpox, and 6 of them succumbed to smallpox. In the mid-1800s, surgeon James Marion Sims, known as the modern father of gynecology, developed cesarean section and other techniques on slave women without anesthesia. In the early 1900s, sterilization of mentally ill patients began, and African Americans were 4 times more likely to be sterilized than their white counterparts. And then, of course, everybody's familiar, beginning in the 1930s, with the 40-year experiment where African Americans in Tuskegee were allowed not to be treated for their syphilis infections. So it is very reasonable that our community is apprehensive, reluctant to take these vaccinations. As the mayor told you, I am willing to take this vaccination. As he told you, he is willing to take this vaccination based on the science. We don't want to be left behind here. Our mortality rates in the African American community are much higher than our counterparts in the Caucasian community. Gary has a much higher mortality rate than other communities. So this vaccination is what has been given to us to prevent this, to fight this. And so we have to have confidence in this. And I have all the confidence in the world, having reviewed what I've reviewed, the science of it. And it's up to me to try to convince you, the public, of the same thing. So I'll be saying these messages over and over. I'm very, very happy that the mayor has as well accepted and pushing this information. So I hope over the next several weeks and months, if you have questions, you contact me. I will go as many places as I can to try and get this information across, because it's important to us that we take this vaccination, and I'm very happy today that this vaccination process has occurred. And so I'm going to now turn over this lectern to our chief of police, who, once again, I must commend, because he's taken on the responsibility of enforcing these rules that we had to fight this virus. And so thank you very much, Chief Evans. I so appreciate you and all the work you do. And now, coming to the podium is Chief Evans.
Thank you. On November 23rd, the mayor, Dr. Roland Walker, and the health department had a voluntary meeting for our businesses, club owners, to come and speak to us at the Gary Genesis Center about compliance issues and the rules and guidelines that will be in place during this pandemic and the rules going forward when we hit a certain level of infection rate within our city. In that vein, on December 5th, the Gary Police Department began enforcing our compliance issues for businesses throughout the city, and in accordance with the guidelines of the Gary Health Department and the recommendation of these businesses by our Health Commissioner, Dr. Roland Walker, the Gary Police Department cited 8 businesses under the governor's executive order, and then we temporarily shut those businesses down. Those businesses were the Voodoo Lounge, the Loft, Playos Club, Hunter's Lounge, Roxy's Lounge, the Zanzibar, Panthers, and Temptations. At that time, we shut them down temporarily and gave them a citation on that weekend. And since then, we have gone back out, in addition to our health department, our code enforcement, and our fire department, to check for compliance. And I'm pleased to report that since that time, we haven't had to revisit those locations, with the exceptions of Honey's, who we shut down this weekend. We don't do this lightly, and we don't take this as a punitive steps. We continue to shut down businesses who are not in compliance with the guidelines of the Gary Health Department as a matter of public health. But we are all responsible for each other's safety, and following the advice of our health professionals is imperative to stopping the spread of this virus and from purging it from our communities. In addition to that, we want to make sure that everyone's safe and healthy throughout this holiday season, and able to enjoy themselves and enjoy their families. Like Dr. Walker, I have had a personal experience with this, and my staff has had personal experience with this, and many of our officers have had personal experiences or have been touched by this virus. We don't want to visit your businesses or to have to give you a citation or do anything like that, but we will as a matter of public health and public safety. We thank you for the ones that have complied and the ones that are complying at this time, and we ask that you continue to work with us and our health professionals to purge this virus from our communities and from our neighborhood. At this time, I would like to turn it back over to our mayor.
Okay, thank you, Chief. Thank you, Dr. Walker, and thank you all for being here today. You know, in closing, as we continue to fight the spread of the COVID-19 virus, city continues to operate. In fact, this Thursday, I plan to release my first State of the City speech. It's going to be in video form so that we can get our message out to as many people as possible. This year, I chose to record the message because I think it's important to take the message directly to you, our residents, and not just a room full of people who buy tickets to a State of City event. Also, we've opened warming centers to provide temporary places and shelter for people who will be affected outside of when the weather becomes inclement, rather. And those shelters are the Ambridge Men Pavilion will be open at 2822 West 4th Avenue, which will be open from 5 p.m. till 7 a.m. Roosevelt Pavilion at 2201 Harrison Street, which will be open as needed. Glen Ryan Pavilion at 4220 East 6th Place, which will also be open as needed. And the Calumet Township Multipurpose Facility at 1900 West 41st Avenue, which will be open from 8 a.m. to 1 p.m. There's one other facility which is for men only, and that's the Brothers Keeper Facility at 2120 Broadway, and it'll be open from 8 a.m. to 1 p.m. And again, as I said, when the temperatures drop to 32 degrees or lower, we will certainly open our shelters. This week, we'll release a video with more details on how to use the warming shelters, but please keep the following in mind. You will need to take a COVID-19 test when you arrive at the warming shelter. If you test negative, you will be allowed into the facility and directed to a cot. If you test positive for COVID-19 virus, you will be given the option of leaving the shelter or accepting a ride to a quarantine facility, but it'll be your choice. Again, we will post more details on this soon. Finally, please remember that this is a public health crisis, and we have a long way to go to continue to protect our community. But as I've said all along, if we remain calm and if we continue to look out for each other, we will get through this together.